Despite an ever-growing number of diet products and health initiatives, Canadian waistlines are expanding. In less than a decade, it's estimated that 10 million Canadian adults, that's more than 1 in 3 of us, will be obese. And the cost to treat obesity-related illnesses is expected to swell to $33 billion a year. Dr. Arya Sharma is the scientific director of the Canadian Obesity Network. It's nice to see you, sir. Why is this such a persistent problem? What is it that's preventing us from making some progress on this?
Well, I think the key issue is that obesity is a very complex problem in that there are so many drivers of obesity. See, the obesity problem is very often compared to the tobacco problem, and people often say, well, we've done something about tobacco. Why can't we take the same approach and apply it to obesity? Well, with tobacco, you had one problem, you had one agent, and you had one product that people were trying to sell. When we talk about obesity, you're talking about, a whole slew of issues that promote weight gain. And so it wasn't surprising to see, when the Canadian Senate came out a couple of years ago with a report on how we can address the obesity epidemic. They had 21 different recommendations on things that need to be in place for us to have any impact on trying to prevent obesity. So it's not a simple problem to tackle. We talk about it a lot, but when you look at what's actually being done to prevent it, or even what's being done to treat it, we're not doing a great job here.
I mean, at the end of the day, though, is it not just sort of fitness and activity on the one hand and healthy eating on the other, or is it in fact more complex than that?
Well, I think it's actually the notion that obesity is just about, being physically active and eating properly. That is one of the biggest barriers in trying to tackle the epidemic, because it's far more complex than that. When I tell a patient, who's asking me, doctor, how can I manage my obesity? Well, you just need to eat less and move more. Well, that's about as effective as telling someone who has depression, listen, you just need to cheer up.
Right.
It is far more complex than that. The Canadian Medical Association came out a couple of years ago and actually said we have to look at obesity as a chronic medical disease in its own right. And that was based on all of the evidence that we have that obesity, once you get it, and there's a lot of different reasons why people might put on weight in the first place, it really becomes a lifelong struggle for people. And that might come as a surprise, because there is this billion-dollar industry there that promises everlasting weight loss. Unfortunately, none of those products, none of those approaches actually work. And so, unfortunately, for the 7 million Canadians who already are living with obesity right now, right today, we don't have a system in place that is actually going to deliver chronic disease management to these people for this chronic condition.
Right, and I don't want to sort of detract from any of that. And I think my notion about health and activity and a healthier diet, that was more aimed at sort of the next generation of kids that are coming up now and preventing them. Is it that the current generation of people, as we struggle with being overweight and obesity in our sort of current society, that we're not passing on those healthy habits?
Well, absolutely. I mean, there's no question that, when you have a chronic disease that's affecting so many people, you have to do what you can for prevention. And eating a healthy diet and being more physically active, those are just good health behaviors that everybody should be practicing. Whether you're trying to prevent obesity, you're trying to prevent cancer, you're trying to prevent heart disease, the formula is always the same. The formula is try to eat as good as possible and try to be as active as possible. And by the way, now we talk about getting enough sleep, because a lot of Canadians are not getting enough sleep either, and we know that kind of ties into this whole health habit, discussion. But that is advice for everybody. That's whether you have an obesity problem or whether you have a weight problem, it doesn't matter. If you eat better and get more physical activity and feel better about yourself and get enough sleep, you're going to be a lot healthier at any weight or any size. Right. When it comes to obesity itself, and here again, we're talking about people who have actually gained weight and we're trying to prevent that problem from getting worse. You have to really look at what is the driving force behind obesity for that individual and what are the treatment options for that individual. And that's really, unfortunately, where things get a little bit more complicated than simply, handing people a food guide.
Understandably. There's a stat I want to run by you, because when I first read it, I seriously thought it was a typo, that the number of obese kids worldwide since 1977 has gone up by 1,000%. Is that true?
Well, you started from a very low level because childhood obesity was
Worldwide.
not something.
Right.
Worldwide childhood obesity was never a problem. So even a small increase, is then going to be thousands of percent points. But there's no question that we are seeing a lot more kids today who have obesity or who are in that overweight category than ever before, and that is certainly a reason for concern, particularly because we talk about the problem of treating obesity in adults, and we don't really have good treatments for that. But forget about kids. We don't know how to treat obesity in kids at all. None of the medications, the bariatric surgery, none of the programs we have in place have actually been shown to effectively prevent kids who are struggling with excess weight from becoming adults who then struggle with excess weight. So yes, there are some programs out there where we can treat childhood obesity, and see some results, but we don't know whether those results are going to translate into long-term results. So the problem with childhood obesity, it's an even bigger problem because the solutions and treatments we have for childhood obesity are even less than what we have for adults.
And I think it's the WHO is talking about by 2025, 33 to 34 billion in obesity-related healthcare costs. What about the indirect costs? Because those numbers would probably go up dramatically if we looked at indirect, wouldn't it?
Well, let's start with the direct cost because, what they're talking about is the cost that it would take to treat all of the problems that obesity causes. So we're talking about people treating people for their diabetes and their heart disease and all of that. But let's be very clear, we're not actually spending any money on treating obesity. We spend a lot of money on treating diabetes. We give people new hips and knees, and sleep apnea machines and whatnot. That's where the money's going. The money's not going on actually treating obesity. Which might be a much better use of that money because we know that if you effectively treat obesity, then you can prevent all of those other health care costs that are out there. So you can count them as direct or indirect costs, but the bottom line is, yes, it's costing the healthcare system a lot of money, but that money is not going towards where it perhaps should be going, and that is treating obesity. And now let's talk about the indirect costs. Now, obviously, often we get stuck with the physical problems. So yes, there's no doubt that obesity, causes diabetes, causes a whole bunch of other medical problems. But there's also a huge psychological and, if you want, emotional load and societal load that comes with obesity. We have rampant discrimination and weight bias affecting people living with obesities, and this has been demonstrated in every setting. The media portrayal of people who live with obesity. Right. In education settings, and this starts in primary school, where the expectations of teachers for kids who have struggled with weight happens to be less than for kids who don't have a weight problem. This has been demonstrated in employment settings, where the chances of even getting hired or getting promoted, especially if you're a woman, is almost directly related to your appearance and your size. And then, unfortunately, I must admit this, even within the healthcare system, there's quite a bit of evidence that if you present in your doctor's office with excess weight, then there is going to be some shame and blame that you're going to be faced with. So people are dealing with this in a lot of different ways. It's not easy to be living with obesity today, which is probably why most people are trying to lose weight all the time.
Indeed. It's a hugely important subject, and we're really glad to get you on. Thanks so much for this.
Thank you.
Dr. Arya Sharma, Scientific Director of the Canadian Obesity Network.